Alcoholic liver disease is a topic I chose. It's caused by excessive amounts of alcohol within the diet. As you consume alcohol, your liver is what mainly processes it, and acetaldehyde is a chemical that builds up and basically destroys liver cells, leading to inflammation. And over time, this inflammation causes fibrin deposits, leading to a scarred liver that loses almost all of its functionality. There are several signs and symptoms of this disease. The most classic one would be jaundice, which is the yellowing of the skin and your eyes mostly due to the buildup of bile within the blood. There's also hypertension would be a sign, mainly portal hypertension, which is where the hepatic artery and the portal vein begin to be stressed because the liver is actually squeezing around them due to the scar buildup. This can also lead to esophageal varices, which would be the vessels from the liver leading up to the esophagus. These can actually bust and lead to fatal bleeds. If caught in time, a provider can go down with a scope into your throat and actually inflate a balloon to prevent the bleed from getting worse. Medications are also given for alcoholic liver disease. One class would be diuretics. In patients with alcoholic liver disease, it's common to see a phenomenon called ascites, which is the buildup of fluid in your body cavities that should be hollow. Mainly, you'll see it in the belly area. You can actually tap on it and see waves of fluid underneath their skin. It's caused by the lower amount of protein within the blood because the liver is the main protein absorber basically within the body. Whenever it's damaged, you're not getting the amount of protein that you might be eating. So in capillary beds, when the arteries go and perfuse the tissues, and the vein part of the capillaries are supposed to reabsorb that fluid, when there's not enough protein, these veins can't suck up all the fluid back. So the diuretics are going to help eliminate that excess fluid throughout the urine, basically. Antihypertensives are also usually prescribed to lower the hypertension seen throughout the portal area, which would include the hepatic artery and the portal vein, to hopefully decrease the risk of bleeds from basically these vessels just bursting from the pressure of the liver. A liver transplant would also be a viable option for these patients, but they would have to cease any alcohol consumption whatsoever, because if they express their feelings to want to continue drinking alcohol, they're going to be kicked off the liver transplant list because organs are extremely rare to come by in the healthcare industry because of how many people need transplants, that they are really only given to those who are judged worthy almost of trying to live as full of a life as possible, as unfortunate as that is.